Okay, how was your visit to the emergency room?
Mary Evans, a 49-year-old Caucasian female admitted through the emergency department, is now on the general medical unit. She is having visual hallucinations and fearful beliefs about others. The patient's medical history includes end-stage renal disease with hemodialysis, hypertension, CVA, and insulin-dependent diabetic. The patient and family deny any history of substance abuse. Diagnostic data includes hemoglobin 11.7, hematocrit 37%, white blood cells 7,900, platelet count 175,000. Chemistry shows sodium of 141, potassium 3.4, BUN 26, creatinine 6.7, glucose 386, and TSH 3.88.
So how are you feeling now, Mrs. Evans?
I feel bad. I haven't slept in 2 nights. I feel bad. I need the medicine.
Well, let me put the rails up before I leave the room, and then we'll come back and check on you.
Her family reports that she has an increase in confusion and hallucinations. Mrs. Evans takes Flagyl for a stomach condition, and the family think that this may be the source of her problems. The family reports that she has had hallucinations for 2 years, but they have worsened over the past 2 days. Mrs. Evans saw a psychiatrist about 1 year ago and was started on medication, but only took it for 1 week. On occasion, Ms. Evans thinks she sees her dead sister Margaret and talks to her.
Margaret? Margaret, get these cats off me. All these cats, they scare me. Get them off. Margaret, get the cats away. Go away. Margaret? Margaret, that ambulance guy, he kept taking his pants off. He wouldn't stop. I told him it was awful, and he wouldn't stop. It scared me. Why didn't you go with me, Margaret? You just left me. You left me with that guy, that man.
Later in the evening, Mrs. Evans becomes increasingly agitated and anxious about her hallucinations. She is trying to get out of the bed and is yelling loudly.
Somebody! Does anybody hear me? Help! I need out of here!
Miss Evans,
help!
what's the matter?
Help me! Please help me! There's a snake in the curtain there. See it? See, there's a snake. And all these cats. Where do they all come from? Oh, Margaret, I'm glad you came to help me. It's like yesterday when you left me with that man. Margaret, will you help me? Margaret, no, don't drag me. Stop dragging me. The sticks and rocks, they hurt me.
Is there anything
Margaret,
I can
stop.
do for
Don't
you
hurt
right
me.
now?
I'm so scared.
Is there anything I can get you
Oh,
right now?
we'll never
to
find our
calm
way
you down?
home.
Ms. Evans is now your patient. What actions would you take first? How would you communicate with Ms. Evans? Give your rationale. What assessment data should you gather to assist in the identification of the appropriate nursing diagnosis and nursing actions?